Hi, I'll tell you about the instruments used for adenoidectomy. This video is mainly meant for MBBS students and those postgraduate students who have taken up ENT as a specialty. So, before going into the main topic, let me tell you about the history of surgery. Acharya Shushruta, this name is very well known in the field of medicine. Every medical student will be knowing this name. He lived in the 6th century in Kashi, the modern Varanasi. And do you know that he has designed about 120 instruments and he has performed about 300 different type of surgeries in the 6th century. Now, in the 10th century, there was an Arab known by the name Al-Zahrawi or Abu Qasim. He is an Arab who lived in Spain. He has written a 30-volume book, Medical Encyclopedia. And he has designed about approximately 200 different surgical instruments, which was followed in Europe and Western world for a very long time. This is in the, mind you, in the 10th century. Much before that, our grandmaster Acharya Shushruta has already designed 120 instruments, and he has already mentioned, Acharya Shushruta has mentioned about adenoids, saying that there's a growth-like structure behind the nose, mainly in children, which leads to breathing difficulty. And he has designed ring-like instruments to scrape off the adenoids. And same was tried by Abu Qasim also. Now, coming to the in 1880s, till 1880s, all the adenoid surgery were done transnasally. Only after 1880 it became transoral, and that too without anesthesia. And there was a bleeding chance was very high, and it was very painful also. In 1920, anesthesia was introduced for doing adenoidectomy. In 1867, a Danish surgeon called Dr. Mayer was the one who detailed about adenoidectomy, the procedure, how to remove the adenoids. And he used a small ring-shaped instrument. With that, he used to scrape off the adenoids. Now, at the same time, when he was performing the surgery, other surgeons at the same period, they used to grow their fingernails long, and with the long fingernails they used to scrape off without any other instrument. With their own fingernails they used to scrape off and remove the adenoids completely. Those were the days. Now, coming to the modern treatment, how it is done, I will tell you about each instrument and where it is used during surgery also. This is an adenoid surgery being performed. So we have a child placed here. Now the child is straight. We have to lower the head end of the table. See, the staff nurse is slowly lowering the head end. There is no sandbag, and head ring is not necessary. If you want, you can keep one. Without a head ring also it can be done. Now coming to the instruments, we have the adenoid curette. This is called the adenoid curette. This is with cage, and we have with cage and without cage. Next, you have Boyle Davis mouth gag. This tongue blade has to be introduced here. There's a tongue depressor, and there's a groove also, which lodges the endotracheal tube, and there's a guard for it. This is a plain mirror. This is a wasp forceps. There'll be a single tooth there. I'll tell you what is the use of that. That is younger section. This is the adenoidectomy set. Now, these instruments I have explained. First, place a gauze piece in the upper incisors. Position the Boyle Davis mouth gag. Position in such a way that the tongue depressor, depresses the base of the tongue and does not touch the posterior pharyngeal wall. Once that is done, don't hold with the hand. Most probably the sister will help you. Do not use the bipod stand. Do not use the bipod stand. Now, the staff nurse is holding it. What I'll do is, a catheter, small catheter, I'll introduce through the nose and bring it out through the mouth and retract the soft palate. And either you can tie it up or you can hold it with the artery forceps, whichever is easy for you. This will retract the soft palate. Don't make it very tight. Now it is done. I am introducing a throat pack with the forceps. For this, usually a non-tooth forceps is used. Pack nicely so that the patient does not aspirate. So once that is done, examine with a postnasal mirror. Examine the size of the adenoids. With the finger, palpate the hard palate, if there is a notch or not. Then palpate the adenoid also. Introduce the adenoid curate through the sides. It will go through the sides. Once you enter the postnasal space, turn it 90 degrees. Hold like a dagger. Hold like a dagger. With a single sweep downwards, remove the whole adenoid as if possible completely with a single sweep. I am taking it out now. See the adenoid. This is the curate with guard, with cage. So I will open the cage. I will show you the adenoid tissue. See, that's the adenoid tissue. I have removed that. Now, whatever remnant is there, with light pressure and if possible with flexion of the head, with slight flexion of the head, you can remove the remnant. Then we will place a postnasal pack. Since we need to flex the head, that's why I am not using a bipod stand. Now I am introducing the postnasal pack. I will leave there for 7 to 10 minutes. That's the clotting time. I will leave it like that. So I have mentioned all the different instruments, and now I am using the Younger's forceps suction also. Leave the pack for 7 to 10 minutes. See, it's bloodless, no bleeding at all. Blood is not filling up here, it's clear. After 10 minutes, take off the pack and take off the throat pack also. When you take out the throat pack, please inform the anesthetist and make double sure that it's not bleeding. And re-examine the postnasal space with the postnasal mirror, with a plain mirror. I'm flexing the head just to see whether it's bleeding or not. And do not prop the nasopharyngeal area. Once you have confirmed there is no bleeding, remove the catheter. Double check for all the counts that you have not left anything. Slowly holding the endotracheal tube, remove the Boyle-Davis mouth gag. Now it is done. Examine the teeth. Examine the tympanic TMJ joint. TMJ joint. Examine the lips. This is about instruments of adenoidectomy. Thank you so much. Mainly, we have used adenoid curette and Boyle-Davis mouth gag, and other instruments I have already mentioned. See, this adenoid curette, there's a blade here, sharp blade here, which is also called as a window. And this is a shaft which can be removed. This is a handle. So adenoid curette you have with cage and without cage. The next one is Boyle-Davis mouth gag. The tongue blade is designed by Boyle and the mouth gag is designed by Davis. So Davis gag frame and Boyle's detachable tongue blade. And there's an adjustable lever here. These are the different parts of Boyle-Davis mouth gag. And there's a central groove in the tongue depressor, metal tongue depressor, which houses the endotracheal tube. And this one is U-shaped frame. So these are the different parts. So I have told you about two main instruments used for this. So I have written a book called Instruments in ENT. This is a 4th edition, which is available in Amazon. And every instrument in this book, I've detailed the way of handling it, how to use it, what are the indications, and each instrument, I have given the different parts of the instruments too, like how I have shown here. Thank you so much.